reconsidered what you said a few weeks ago about an 80% vaccination target in light of this outbreak?
Well, firstly, I'll say this, that fortunately today we have 2 more large vaccinations hub open throughout the state. So we have plenty of access points now in New South Wales. What we don't have is the doses of the vaccine, which we understand will be arriving in larger quantities in mid to late September. But in relation to our target, 10 million jabs, or 80% of the adult population, is about 60% of the population all around. And what we've seen, unfortunately, with the Delta strain is that younger people are getting it. In households, normally in a household, other strains wouldn't have it transfer to children, but we are seeing that. And I will ask Dr. Chant to talk about that, because that means we have to be on our guard in a different way than we have been before. And I will ask Dr. Chant just to talk about that, because in previous strains, we had not seen younger people get the virus in the way they are or transfer the virus in the way they are. And that's why vaccination in relation to the Delta strain won't necessarily just mean adults, which is where the 10 million jabs came from. It will also mean younger adolescents and younger children. And can I please ask Dr. Chant just to make that point, because it's an important health message to show how different the Delta is compared to other strains.
Just before you hand over, though, can I just ask, though, so are you sticking with the 80% adult population? You think we need that to
Look, we'll always take the advice of the health experts. We'll always take the advice of what experts around Australia and around the country are saying. But in relation to the 10 million jabs, nobody was prepared to set a target. We did in New South Wales. We've about 3 million jabs through. 10 million jabs is a jab number that we want to set as a target where we can consider completely opening up and living freely. But if there are, which again equates to about 62% of the population in total. So I want to make that point. 80% of the adult population, 10 million jabs only gets us to about 62% of the population vaccinated, which is why I want Dr. Chant just to explain the threats of the Delta virus within children, and which is an important point. So I'll come back to answering questions, but I do want Dr. Chant just to make this point from a health expert perspective, so that we're all aware that this is now a deadly disease which impacts younger people.
So thanks, Premier. So just a couple of the characteristics of Delta strain is we are seeing more infections from children spreading, which is not the characteristic we'd observed with the previous strains. So that means we need to rethink and think about our role of vaccinating children. It's pleasing to see in some countries overseas that we have vaccines that are licensed for use in children. And I know the regulator, the TGA, is often continually considering the vaccine. At the moment, we have a shortage of supply of the vaccine. But we do have adequate supplies of AstraZeneca vaccine, and I'm just urging our population coverage, even for the over 60s, is not high enough. And we have a good vaccine that can be used, where the risk of hospitalisation and death is very high as age increases. It is present across all age groups. So I just would urge people to go out and access AstraZeneca vaccine and go and have that discussion with your doctor. Obviously, the Delta strain transmissibility will make us have to rethink about the level of vaccination. And I think I'm alluding to the fact, or probably stating it clearly, that I think having vaccines available for children, particularly high school children, will be really useful in rolling out those vaccines. And I think we also need to get the community used to the fact that we'll be doing booster doses. So whilst we need to firstly get everyone vaccinated, shortly after in 2022, we will be probably giving vaccines, more specific vaccines against the new variants of concern. So I think that we need to see that our journey of...
Good afternoon, Brett McLeod with you. The Premier is about to give us an update. We'll take you there right now.
Cases of coronavirus to be reported today. All of them are linked to the current outbreak, so that's 72 active cases in total. One of those cases was isolating throughout their infectious period, and the Chief Health Officer will speak to that trend and what we hope to see more of that in coming days. There are 15,800 primary close contacts who are in quarantine, that are isolating at home or in another place which we have supported them to secure. So that's the best part of 16,000 people who, to protect all of us, are staying at home. We thank them very much for them being compliant with the orders, with the requests that have been made of them. That's no small thing, and we're very grateful to each and every one of them. There are now 250, in fact more than 250 exposure sites that are connected to this outbreak, stretching from Phillip Island to the Mallee. This is from one end of the state to the other, literally, not just in Melbourne, but indeed right across our state. That is very challenging. The good news, though, is that there were just under 55,000 tests, the results of which were received and are in these numbers. So that's 55,000 people, close enough, who have queued, who have waited, who have played their part in not only keeping their family safe, but keeping every family safe. And we're deeply grateful to each and every one of those, as well as the many staff playing many different roles to bring this outbreak into, to get that sense of absolute control over this outbreak. We're not there yet, though, and I'll come to that in a moment. Just on Mildura, we believe this to be the first case of coronavirus in that community since March last year. So this is challenging for the community of Mildura. We've put on some additional testing capacity, a pop-up clinic at the rec centre. I would not necessarily call for everybody across Mildura to go to that testing centre. If you need to get tested, then someone will contact you. Or if you have symptoms, of course, go and get tested. But we're not moving to community-wide testing up there just yet. And if everybody turns up at that pop-up, then obviously there will be very long queues, and we don't want that to be the case. It's a much more targeted effort, but it is additional effort, and we're also supporting the Mildura community in lots of other ways, whether it be speaking